Sacramento, Calif. More than 700,000 immigrants living illegally in California will have access to free health care starting Monday under one of the state's most ambitious coverage expansions in a decade. It's an effort that will cost the state about $3.1 billion a year and move California closer to Democrats' goal of providing universal health care to its nearly 39 million residents. Gavin Newsom and lawmakers agreed provide access to health care all low-income adults, regardless of their immigration status, in 2022 through the state's Medicaid program, known as Medical. Although California is the most populous state to guarantee this coverage, Oregon began doing so in July. When Newsom proposed changes 2 years ago, he called the expansion a transformative step toward strengthening healthcare system for all Californians. Newsom made this pledge at a time when the state had the largest budget surplus in its history. But California faces a record $68 billion budget deficit as program kicks off next week, raising questions and concerns about the economic consequences of expansion. Regardless of your position on this, it doesn't make sense for us to be adding to our deficit, said Republican Sen. Roger Niello, vice chairman of the Senate Budget and Fiscal Review Committee. Immigration and healthcare advocates who fought for changes for more than a decade said expanded coverage would close a gap in access to healthcare and save state money in long run. Those living in the state illegally often delay or avoid care because they don't qualify for most insurance coverage, making their treatment more expensive when they go to emergency rooms. Chief Operating Officer of AltaMed in Los Angeles, California's largest federally qualified health center. This is a win-win situation because it allows us to provide comprehensive care, and we believe this will help our communities stay healthier, said Efrain Talamantes. The update would be California's largest healthcare expansion since the 2014 implementation of former President Barack Obama's Affordable Care Act, which allowed states to include adults in their Medicaid programs who fall below 138 of the federal poverty level. California's uninsured rate dropped from about 17 to 7, but a large segment of the population was left out, adults living in the United States without legal permission. Although many have jobs and pay taxes, they cannot benefit from most public benefit programs. Some states used tax revenues to cover some of the health care expenses of some low-income immigrants. California first expanded health care benefits to low-income children without legal status in 2015, and later added benefits to young adults and people over 50. Now the last remaining group, adults ages 26 to 49, will be eligible for the state's Medicaid program. The state doesn't know exactly how many people will enroll through the expansion, but state officials have said more than 700,000 people will have full